The Liaison and Diversion scheme in Coventry demonstrates successful integration between the police and local NHS staff. The Offender Management Unit and local NHS staff work side by side in the same office in an effort to bolster the service they provide as a tool for identification, assessment and referral of people who come into contact with the criminal justice system with certain vulnerabilities.
I've been doing offender management now for 3 years, and prior to these guys coming into the office, I'd never referred any of my offenders into the mental health or support arena. But since them arriving, I think probably 80% of mine I've had a conversation about, and that's just through working in the same office together.
From sort of my team's perspective, it also allows us to, whenever we're sitting having that conversation about whomever, it allows us to actually tease out sort of some bits and bobs that maybe wouldn't be on a standard referral form into mental health.
With this level of communication between the two teams, not only does it allow the services to identify new cases from within custody, but it also allows for the identification of those who were already well known to the local police and custody staff.
I got myself into the criminal justice system by committing low-level offences back in 1996, but I became majorly involved in the criminal justice system around about 2001 when I suffered a personal injury and just thought my life was going downhill, didn't care about myself, so I started to commit quite a lot of offences.
In cases like this, where mental health problems are so heavily linked to a person's offending, Liaison and Diversion have been able to address some of the core issues at the heart of certain behaviours.
If I hadn't got that support from L&D, I wouldn't be here now, I'd be in prison. I'm almost sure of it. I would have been homeless, I wouldn't have had anywhere to live, I would have probably had to go back to offending, the wrong crowd, drug use.
For the staff working on the Liaison and Diversion project in Coventry, working so closely together makes perfect sense. They share a commitment to better early intervention, especially if in the long term it means the outcome for the people they come into contact with, as well as for those who work on the service, will be better.
If we can keep people out of custody suites, out of the criminal justice system, which is hugely expensive, then that's one big advantage to it. And let's face it, once you've been arrested and you're in a custody suite, the people that do end up in there, they're very rarely strangers to us. The neighbourhood teams are embedded and will probably be able to tell you a story about each and every one of them.
The more times people go through the criminal justice system, the more times they're in court, the more times in prison, typically the worse outcomes we see for people. So we're seeing a huge impact. If we can get to somebody and provide the right kind of support and pathways to them before then, actually their well-being and recovery just stands so much of a better chance.